beautiful day on our health platform. It's your health program or segment that brings healthcare, make it accessible to you beyond your doorstep, because we bring you the best and seasoned health professionals to make sure that you get the right understanding of whatever health challenge you or your loved ones might be experiencing, where to get accessible medical treatment, and of course, if there be a way out, how you can manage yourself at home. Welcome to another beautiful day. Today, of course, is the World Hypertension Day. How much do you know about the silent stealer of our health, the hypertension? I have two personals in the house. I have Dr. Asore Emmanuel. He is the Senior Registrar Cardiology Unit, Federal Medical Center here in Asura. He's seated very close to me. Dr. Emmanuel, good to have you on our platform.
Thank you for having me.
All right, seated next to him is Dr. Madoka Okorafo, also Senior Registrar Cardiology Unit, FMC Asaba. Dr. Okorafo, good to have you.
My pleasure.
You're welcome. All right, so gentlemen, I'm the only lady here, by the way. So gentlemen, the coast is clear. It is the World Hypertension Day. So let our audience actually understand what this is all about. Because I understand today we have to learn how to measure our blood pressure accurately, control it so that we can live healthy. All right, I'll start with Dr. Asore.
Thank you very much for having me here and having my colleague also. Today is World Hypertension Day, which has been in celebration since 2005. Okay. And it's an important celebration because we know what hypertension is. But this is more of an educative session rather than an academic session. Okay. So we'll try as much as possible to come very down so that everybody, the body learned and otherwise, can also understand us.
Okay.
Yeah, hypertension is a leading cause of so many diseases, so many cardiovascular and non-cardiovascular diseases. So it is very important that we understand what hypertension is and also the preventive measures and also the complications. Because so many persons just know the word BP. They don't even understand what it actually means. So this is an avenue for us to educate the populace and also promote the treatment measures. Thank you.
All right. Dr. Madoka, I want to add something to what Dr. Mada has already said.
Well, like he rightly said, this has been a celebration since 2015, and it is well known that at least one person out of every 3 in Nigeria has hypertension. And so that goes to tell us how serious this condition is in our country, and the need for us to be very, very, it's something that we have to be aware of and something that we have to tackle closely, looking at the complications, like you rightly said, that are associated with this, especially when poor control is not given.
Okay, because I do understand that this year's theme for World Hypertension Day is measure your blood pressure accurately, control it, and live it. All right, Dr. Asore, would you like to throw light on the theme for this year?
Okay, thank you very much. The theme for this year, as you rightly said, know your numbers. So live it and measure it. Then, for hypertension, most persons, as we said, they don't know their blood pressure, and that is a major challenge we're having. Like my colleague rightly said, 1 of every 3 persons are hypertensive, but they don't know. Hypertension, as we know, or some people know, it is called the silent killer. It is called the silent killer for a reason, because most persons with hypertension, they don't have symptoms. Okay. So most persons, they're hypertensive, but you don't really know about the blood pressure level. So the only way you can know you're hypertensive, it is only when you check. And when you check, you have to go to the medical facility and check your blood pressure accurately. That is when you can know that you have hypertension. And once you understand that there is a family history, meaning that maybe somebody in your family has hypertension and is on medication, be your father, mother, or siblings, please, it is important you know your numbers so that you can manage it accurately. Because the goal is always to prevent because these are conditions that you live with. They are not conditions that you can cure. But there are cases and scenarios where there are causes of hypertension that you can tackle the main cause and the blood pressure will be controlled. But majorly, it's a condition that we inherit from the family line. So when the numbers are there and you are hypertensive, it's important that you treat. And there are some other things we'll explain as the program goes on. You understand how we manage the blood pressure.
All right, if you're just joining us, this is Your Health, and today we are looking at hypertension. And of course, the theme for the platform today is know your numbers. That is, measure your blood pressure accurately. That way you can control it and live longer. All right, Dr. Suri, I'm coming straight on to you. You said earlier in the introduction that many persons don't even know they are living with hypertension. It's probably in the family line. We live in a country or a society where we are always disclaiming, not my portion, my family doesn't have it, my forefathers, nobody have had hypertension. But yet, you still stated now that many persons live with hypertension, they do not know. And of course, like you also said, hypertension does not show symptoms because it's always a silent killer. All right, now, so what exactly is hypertension and what could be the main cause?
Thank you very much. As we say, know your numbers. There's a reason we make that statement, know your numbers. Hypertension, when you check your blood pressure level and we're seeing greater than 140/90, please, that individual needs to be monitored closely. So it is important we check our blood pressure to know the values. As I rightly said earlier, once there's a family history, that is the major cause of hypertension, family history. So there's an inherited pattern to hypertension. There are other causes, other measures that can cause hypertension. Things like there are some medications that people take indiscriminately can cause hypertension. There are some kind of hormonal imbalances that can cause hypertension. There are some kind of hard drugs that people take, tobacco, cocaine, and so on. They can cause hypertension. So those are some causes of hypertension that you asked which are the causes. But the major cause, as we say, it is inheritable.
Inheritable, yes. Family line. Okay. For instance, I'll say my great-grandfather, he lived into his 90s. He didn't slum and die. My grandmother lived into her 120s. She didn't slum and die. But medically, you could allude that she was hypertensive. How come she managed it to that time? Maybe Dr. Karafo will help us to on that.
Okay, if I may start this way. So many people have hypertension and they do not know.
Family line.
Yes. Now, the greater number of people that are even aware that they are hypertensive are not on any medication whatsoever. And so the ones that are on some medications are not even properly controlled. Okay. Now, looking at in the olden days, like you rightly talked about, most of our parents then lived a certain kind of lifestyle.
All right.
Okay. And those lifestyles are not the kind of lifestyles we live now.
We are more sedentary.
We are more sedentary. We are now being involved with eating things that were not there previously, like artificially made food. The people in the olden days, they most of them were farmers, so they were active.
We are more organic too.
And they were more organic. But now we eat more of baked things. We have high sugar in our diet. We have salt in our diet. And so that can lead to or predispose someone to having hypertension.
Contribute to a state of being hypertensive.
Exactly. That is what I'm saying. Exactly. So the example you gave, it's possible that your parents, as it were then, was not hypertensive. It's possible because of the kind of lifestyle that was obtainable then and the kind of meals that they ate during that time. So, but currently we are now adopting European lifestyle. So, a lot of salt, a lot of sugar, a lot of fatty meals, and from time to time we're always sitting, we are not active. So that can lead or predispose somebody to having hypertension. So
How can you say I'm
largely,
not active when I work 8 to 5?
now 8 to 5, yes, but largely what I mean is, if I'm not wrong, you're just sitting down and you're just asking, interviewing people. People then were very active. I mean, they involved themselves in farming, they
Okay.
trekked distance, okay, to get to where they needed to be in at any particular time.
And there's
But
that
co-
heavy energy too.
that is what I'm saying. But currently, we drive into literally everywhere. So that is why we have more of that during our own time. And so largely, hypertension is said to be essential. So we do not know it is essential because we do not know the cause for most people. Even though, like he rightly said, there are genetic predisposition to it. In other words, if your parent, any of your parents, is hypertensive, there is the chance that you could become hypertensive. And so, like he also said, there are secondary causes of hypertension.
Now let's quickly go to
some
that
of-
secondary causes because most persons will say, I've encountered someone who's like 17, average of 17 to 20 years, and they said this individual is hypertensive. And we had a heated argument. How can someone within that age be hypertensive? And they start saying, village people, you're a suspect.
Okay. Now, the secondary causes, some of which he has rightly mentioned, in our environment here, we found out that kidney disease, okay, is a very common secondary cause of hypertension. If somebody has a kidney disease, there's a high chance that person may also have hypertension or may develop hypertension in due course. Okay, he mentioned about the hormonal aspect. Okay, so there are certain hormones in the body. When they are excessive in the body, it can lead to the person may develop hypertension. He
For
mentioned
example,
some drugs.
Do you mind mentioning one of those hormonals?
All right, there's a hormone called cortisol in the body. It's a stress hormone.
A stress hormone.
So when it is high in the body, okay, over time, someone could develop hypertension. That's just one example. Okay, so he also talked about some drugs, hard drugs, young people getting involved in illicit drugs. So
Okay.
these are some of the things that can also lead to hypertension. In addition to the dietary aspect, and then the sedentary lifestyles that we live these days. So that is these are some of the secondary causes.
All right, so if you're just joining us, is the program Your Health, and today we are looking at hypertension. If you do not know, it simply means that you need to know your number, because if any member of your family is disposed to it, maybe your mother, your grandmother, anybody has had hypertension, you have over 50% chance of also being hypertensive. It's not time to start saying it's not my portion, because you're already there, and all you need to do is check your numbers so that you can control it and have a positive life. All right, Dr. Sorry, I'm coming to you. You said hypertension as a disease does not really have symptoms. So there is no way, as a non-medical person, that I could say I'm tilted to having hypertension, or I could say this thing that is wrong with you could be hypertension, check your BP. No sign at all?
Yes, we doctors will keep telling you that there is no sign
Okay.
for hypertension. But some people will say when they start having headaches,
All right.
it means that the blood pressure starts going up or is going up. Well,
Okay.
we don't still throw that information away, because headache, there are more than 1,000 things that can cause headache. So by the time you start attributing headache and hypertension together, you may get it wrong. So most persons, by the time they know they have hypertension, is when complications are setting in. Complications like heart failure. As I said, hypertension can cause so many cardiovascular and non-cardiovascular complications. So by the time people start coming up with heart failure, and you see some patients in the hospital or people walking around with leg swelling. Also, as he rightly mentioned, kidney disease, that is when they know that they are hypertensive. And also, there are some people that they don't have hypertension, they are not on medication, they don't know anything about their numbers. They just slump in marketplaces, in ceremonies and the rest. They check their blood pressure, market elevated. there's a high chance that that person has been hypertensive for a very long time, and we are now knowing that the person is hypertensive when the complications have set in. That's why we always preach know your numbers before the complications set in. So prevention, of course, is always better than cure.
Okay, on that note, prevention is better than cure. We'll take a break now. We'll come back. I still have a Dr. Asore Emmanuel in the house and Dr. Maduka Okorafo in the house, both Senior Registrar, Cardiology Unit, Federal Medical Center, Asaba. We'll be right back. Stay. In case you're wondering who is she, I'm your host and of course your uncle. We're looking at hypertension today, and I have two seasoned professionals in the house. I have Senior Registrar Cardiologist in the house. I have Dr. Asore Emmanuel and Dr. Maduka Okorafo. Doctors, it's so good to have you in the house.
Thank you. Thank you.
Okay, we've looked at definition of hypertension. We've looked at causes. We understand that hypertension as a disease is not usually asymptomatic, no symptoms to show for it, but just little indications. Okay, but now, and you said before the break that prevention is better than cure. So now let's go from that end. How can I prevent being hypertensive?
Thank you very much. My colleague said so many things about the prevention already as he was making these previous statements. Okay. So we talked about, when you ask the pertinent question, then if some persons, their parents are hypertensive, their mothers are hypertensive, but they are not hypertensive, or sorry, their parents are not hypertensive, but they are hypertensive. And he rightly talked about our lifestyle now. Okay. The current lifestyle in comparison to the olden time. Our lifestyle now is more sedentary. When we talk of sedentary lifestyle is anybody that has had work, less than 10,000 work per day. It will surprise you if you check your work. Everybody's handset or their phones, they have steps per day. If you check most of the time, you notice that the steps you have taken in a day, 24 hours, maybe if you don't do any kind of exercise or anything, maybe less than 3,000 or so. So it will suffice you to know that almost everyone that is not active will be living a sedentary lifestyle. So when you say you are active, you've been sitting for some time and then you interview persons, and likewise so many persons. But in the olden days, they don't have access to vehicles, so most of them, they walk from their homes to their workplaces, or walk from their homes to their farms. So they engage themselves very well, unlike now. And also, when we talk about prevention also, if you are genetically predisposed, there are some lifestyle you now engage yourself in that will now fully expose you to those conditions. But when you know you are genetically predisposed to being hypertensive and you try to live a lifestyle that can condone you properly, it may now prevent the onset of the disease. So things like the sedentary lifestyle, as I've mentioned, are food, more of processed food. That's what we're taking now. You see people taking more of salted meals, fast food meals. Those things are more of things that can predispose us to being hypertensive, because salt is a major cause of what increases blood pressure. So we always salt. So we always advocate that once you are getting anything, especially from the supermarket now, because most of the things we get now are processed things, always try to look at the prescription on those things, your Indomie, your seasonings and the rest. Most of them have a lot of sodium. So it is important that we have.
So what we check out for is the sodium content of every product
you buy. So we can also liaise with our dietitians that can help us know those prescriptions better, so that when you are getting anything from the pharmacy, from the supermarket that you are consuming, please always take note of those
In other words, eat more from your farm than the shelf. Okay, Dr. Karafo, a whole lot have been said about lifestyle. I've also looked at dietary, the food intake and all that. Now, what is that normal number? Because knowing your numbers, you have to know how to control it so that you can live positively. And you, at the introduction, you mentioned 140/90 being the indices to indicate you are being hypertensive now. So for a normal person, what is this normal number?
Okay, ideally, we say if you have a blood pressure reading between 100 and 120 millimeters mercury over 60 to 80 millimeters mercury, that is ideal.
Okay, 100 or 120 over 60
Yes.
and 80.
Yes, that is ideal. Now, when you begin to have your numbers between 120 and 139, okay, over 80 to 89, okay, it's still acceptable, it's still within normal, but sometimes we target as the person being pre-hypertensive.
Okay, pre-hypertensive.
So there is a higher chance the person may progress to become hypertensive. But generally, if your blood pressure is less than 140/90, of course, between 100 and less than 140, okay, we accept it. We accept it. So 140/90, any number between less than 140/90, that is between 100 to 140 to 139,
is normal.
over, okay, 60 to 89
Is okay.
is okay.
And if it's less than 100?
If it is less than 100, the person is becoming hypotensive. Hypotension.
Okay, that's what we call the low BP.
That's what they call the low
Okay,
BP.
so once it's lower than 100,
Yes.
it's also not a good.
It's also not good.
It's not good.
It's also not
and
good.
above.
And above 140 and above,
also
okay,
not good.
is not good. So
Okay.
it is good to keep the numbers within this range that I've mentioned.
Okay. Now, Dr. Ford, before I turn up, is hypertension age-related or race-related?
Well, hypertension, you can't really say is age-related. Okay, and you can't really say it is race-related, because the whites, there are hypertensives there.
But I see research showing that the blacks have it more.
Yes, that's what I'm saying, that you can't really say it is for this race
Okay.
or this race, but you can say that you see it more
Prevalent.
in a particular race.
Okay.
Same also occurs with age. With age, certain changes can occur in the body. Okay, but you cannot attach age to hypertension. So that is some of the mistakes people make. You know, somebody having a blood pressure of more than 140/90, and because the person is maybe elderly, they will say, okay, let's leave it.
Okay, that is okay when you are elderly,
Yes.
but
So,
it's not.
It's not. So that is it's something we can take out from this. And also, if I'm to add something very important we've not actually mentioned, is smoking.
Smoking.
Okay, and alcohol intake. Okay, that's part of the lifestyle.
Substance now.
Okay, that can also predispose someone to becoming hypertensive.
All right, Doctor, sorry, quickly, because time is no longer our friends. Let's quickly look at the complications of hypertension and how we can fix it.
Okay. So
We have just 2 minutes more to
okay, so for the worth of time, hypertension, as I've mentioned earlier, it's more of a cardiovascular disease, and the complications are not only limited to cardiovascular. So hypertension can lead to heart failure, hypertension can cause kidney disease, hypertension can even cause blindness. So these are some of the commonest causes, and not even stroke. So most of the persons you see stroke, so it's the leading cause of heart failure, it's the leading cause of chronic kidney disease, it's the leading cause of stroke, and other causes, as other complications I've mentioned, also like blindness. So most persons will always advocate that check your eyes also Once you know you're hypertensive and diabetic, always check your eyes because those are the leading cause of blindness.
Okay, how can we fix it?
Fix.
Yes, as in, how do we manage?
Okay, manage hypertension. Okay, good. So for the management of hypertension, we've talked about the preventive measures. So when you come to management, first of all, you know your numbers. When your numbers is certain, you try and see a qualified medical doctor, either a physician or a cardiologist that can guide you better. And also the drug treatment and the non-drug treatment. So once the drug treatment comes on, it is very important that you take your drugs every day. And also the lifestyle modification, like the diets that we've talked about, more vegetables, more fruits, and your medications. Those are some of the keys to managing hypertension.
All right, thank you so much, Dr. Maduka. Lastly, your take now. Let's just talk to our audience. What will you say to our people out there?
Okay. To our people out there, I want to also tell us to know your numbers. Not just knowing your numbers. If it is high, ensure that you see a physician. Okay? And when you see a physician, adhere to the instructions that have been given. If you're placed on medications, take them and adhere to those medications. And with these complications that have been talked about are unlikely to occur.
All right, Dr. Suri, final take.
Okay. Hypertension, it's funny. The painful thing about hypertension is that it affects the middle class, and those are the class that most people are dependent on, those class of persons. So that is why we come out with always talking about hypertension and the preventive and treatment, because when certain persons who are hypertensive and they are the dependents, they are that class of people that our family depend on. So it is important that those group of persons are treated properly, they take their drugs properly, so that at least they can be there for their families.
All right, take your medications properly, especially if you know your number. That's the only way you can control it, and then you live a positive life. Adherence, if your medication is the way to go. And of course, soft life is good, but you also need to be agile. You need to be energetic. You need to exercise. That way you can also live longer and be productive for yourself. And lastly, make sure you stay off drug abuse and substance abuse, because alcohol and smoking is a highway to hypertension. Remember, it has no symptoms. I want to say thank you so much, Dr. Suri Emmanuel, Senior Registrar Cardiology, Federal Medical Center, Asaba. Thank you for coming.
Thank you very much.
And also to Dr. Maduka Okora for coming, also Senior Registrar Cardiology Unit, Federal Medical Center, Asaba.
Thank you very much.
And of course, a very big thank you to the Nigerian Medical Association, Asaba Zone, for loaning us great resource persons to reach out to our audience. Remember, your health is bringing health accessibility to you beyond your doorstep. On behalf of the crew, I say thank you so much for being part of our outing today. Remember, know your number, control it, and live longer. On that note, take care of yourself. Bye.